There are years in which 4 questions or 5 questions appeared, more than 5 questions appeared from immune system alone. So that time you cannot think, is it patho or microbio? So before jumping into microbio, I would like to clarify whatever you studied in patho. That is why I comprised both together and separately I took it. Am I clear? Okay. Now, we are starting with microbiology, finally. So to start with, as every subject, there are scientists and their discoveries. So Anton von Leeuwenhoek reports bacteria, first observer reports bacteria. Beijerinck coined the term virus. Ehrlich, acid for stain. Frankel, pneumococci. Hansen, leprosy. Hoffman, syphilis. Lister, antiseptic techniques in surgery. Loeffler, diphtheria. Nicolaier, tetanus. Oxton, staphylococci. Pasteur, germ theory, sterilizing technique, hot air oven, autoclave, steam sterilizer. He coined the term vaccine for hydrophobia, anthrax, disproved the theory of spontaneous generation. Robert Koch, TB, cholera, staining techniques. Ruska, electron microscope. So this is what is given in the QRS. But what you need to remember at the last moment, neck of the moment during the exam, or just few of them. So the first one among them I want you to remember is Pasteur coined the term vaccine. Pasteur coined the term vaccine. Very essential point. Okay. Then Hansen is for leprosy. Ehrlich is for acid fast chain. Ehrlich is for acid fast chain. Okay. Loeffler is for diphtheria. So these 4 points I would stress more for your examination. Now, more than these 4 points, there is much important point, that is Robert Koch. He discovered TB, bacilli and V. cholera. This is an old term question, but you must remember, what you must remember here is TB. Almost everyone knows that Robert Koch means they will remember TB, but you should know Vibrio cholera also. That is why this point separately I am saying. So Robert Koch is not only for TB, it's also for Vibrio cholera staining techniques. Okay, I hope everyone will make this MCQ. So for viewing any mycobacterium, for viewing any bacterium, you need a culture media. So for this, what are you going to do? You're going to take a sample, blood sample or a urine sample or a pus sample from a patient. So you're going to send it to the laboratory. There they will grow the organism in this culture media. So based on their growing ability and their growing temperature, they will be grown in different medias. So different medias will be selected. So this is a culture media is a big topic, so I can't cover everything. So here is some basic, all you need to know is the different types of culture media for different organisms. So I'm not going to talk about it now because you are going to see that all over the lecture. So all I'm going to say is simple media, complex media, synthetic media, enrichment media, selective media, indicator media, differential media, transport media. These are the different culture medias that I can say. Am I clear, everyone? Am I clear? Okay, very good. Now, examples, I'm not going to talk about the examples. I'm going to talk about something else. What is a tricky question in this is enriched media versus enrichment media. Enriched media versus enrichment media. This is what I'm going to talk about. Enriched versus enrichment media. Just give me a moment. I have something problem with my touch bar. Yeah, okay. So enriched versus enrichment media. So enriched media, first point you need to remember, enriched media is a solid media. Enrichment media is a liquid media. This is the first point I want you to remember because this is commonly asked MCQ. So enriched media is used to grow the fast growing or necessary microorganisms. So the word that is necessary is fastidious. Fastidious enrichment helps to grow the fastidious organisms, microbes, fastidious microbes. Enrichment is for unwanted microbes, unnecessary microbes. This is the second point I want you to say. Please note it down, very essential for your FMGE. Okay. This is the second point. So the third point is the examples that we already gave. Okay. Then the fourth point is enriched media has antibiotics. You will add antibiotics. Sorry, this is enriched, right? Enrichment, you will add antibiotics. Enriched, you will add nutrients. Nutrients in enriched media, antibiotics in enrichment media. So other than antibiotics, you can add chemicals, but focus in your exam, look for the word antibiotics, look for the word nutrients. So enriched contain nutrients in the form of like egg yolk, blood, serum, etc., whatever. So in addition to the basal medium, there is going to be a basal medium in both of them. So in addition to basal medium, they are going to add extra nutrients in enriched media. That extra nutrients you are not going to add in enrichment media, you are going to add antibiotics or chemicals, dyes, chemicals, antibiotics, or you are going to alter the pH in enrichment media. So these 3 points are highly essential. So I said examples you can read by yourself, but these 3 points are highly essential. Okay, I repeat, enriched is solid, enrichment is liquid, enriched is for necessary microbes, enrichment is for unwanted microbes, enriched is for, in enriched you are going to add nutrients, in enrichment you are going to add antibiotics. Okay. So unwanted is a word I just use, is a common word. So you have to say contaminated, contaminated bacteria, contaminated wound, contaminated infection. So contaminated sample means enrichment. Good sample, that is fastidious microbes, means enriched media. So I hope this is clear. Next, types of bacterial staining. So if you have to look at the organism, you have to stain the organism. So the staining could be, okay, so I think this might need a discussion, but anyway, the staining could be gram positive, gram negative, gram positive, gram negative, or negative staining, that is staining the background, or acid for staining. So these are very essential. These 4 staining methods are very essential: gram positive, gram negative, negative staining, that is the background staining, and acid for staining. Okay. The key point here is gram positive, if you stain a bacteria and if it turns violet, that is gram positive. This is not how it is. It is a huge process, but for your exam purpose, you need to know this. Gram positive bacteria turns violet, gram negative turns red. Gram negative turns red. So red means negative, violet means positive. Okay. Then there is negative staining. I told, staining the capsules, staining the, to demonstrate the capsule. So negative staining means background staining. So spirochetes are stained by negative staining. So you won't believe, 2 questions appeared on same year, that is on 2015. Negative staining is for capsular demonstration. That is the question number 1. That was in the first half of the paper. In second half of the paper, spirochetes are stained by negative staining. So this was a second question. So this is very important. Negative staining is very important. Gram positive, gram negative are older questions. I don't think so in future. Very less chances of that question being asked. So you need to know, as I said, capsules are stained by negative staining. So very important. Okay. So when you strain and see, sometimes the capsule can be swollen. If the capsule is swollen, that is called as Quellen reaction, which is seen in pneumococcus. Quellen reaction is seen in pneumococcus. Okay, then disinfection and sterilization is the next topic. This is a huge topic. We can't go much depth into that, but we will just see some definitions, some processes that is going to happen here, which is essential for your exam in the last minute. So the first point is sterilization. So sterilization, they are not going to ask the definition anyways. So it is defined as a process by which an article, surface or medium is freed from all living microorganism, either in the vegetative or in spore state. That is sterilization. But look at disinfection. This means removal of all pathogenic organism or organism capable of giving rise to infection. Okay, but this does not deal with the spores. Disinfection does not deal with the spores. Sterilization deals with the spores also. Okay, hot air oven is the most widely used method of sterilization by dry heat. So that point you need to know. Then there are different methods are there. So few methods I like to show here is one is flash process. Flash process is a process where you show heat for 72 degrees Celsius for 15 to 20 seconds, which is followed by cooling. So flash means you show heat and then you show cold. So heat followed by cold. Okay. Then filtration is a method most widely used. Pore diameter is 0.22 URN. So that is the pore diameter. Okay. Okay. So not much to talk about them. So we'll directly go for the different materials and the different methods of sterilization or disinfection used for them. So first is the materials. We are going to talk about the materials. So hot air oven is used for any glass. So let it be syringe, let it be petri dish, let it be test tubes, let it be flask, let it be surgical instrument, any glass or surgical instruments, you are going to use hot air oven. Number two is filtration. Filtration, water bath, vaccine bath. Forget about this water bath, vaccine bath. I don't think so you'll be getting a question from them. Filtration is used for any body fluids. It could be serum, it could be body fluids, it could be bacterial vaccine. Filtration is used for serum, body fluid, bacterial vaccine. Next is pasteurization. Pasteurization is used for the milk. Then Sirex. Sirex is something you see often in the OT. It's a colored liquid. It is often seen in the operation theater. It is used for sterilizing the endoscopes, the cystoscopes, the tubes that are used in the surgery, the disposable syringes. So Sirex is used to sterilize them. Okay, then comes autoclaving. Autoclaving is for the dressing, aprons, the gloves. See, this is COVID crisis, so we are often using gloves and or N95 mask. They can be autoclaved also. The suture materials, the culture media, everything can be autoclaved. Then comes tyndallization. Tyndallization is for culture media with egg, serum or sugar. So tyndallization is for culture media with egg, serum or sugar. Then cresol is for shop instruments. The ionizing radiation most commonly is for catgut. That is very important. Catgut. Also for disposable syringe. So bone and tissue grafts, adhesive dressing. So if you get a question that is disposable, commonly asked out by students, disposable syringe, what should I choose? Is it ionizing radiation? Is it ionizing radiation or is it Sirex? You can choose both of them. That is up to the examiner to choose which is the right option according to them. So I would go for ionizing radiation when it's a disposable syringe, but in MCQ, I'd go for Sirex. Generally speaking, ionizing radiation, in MCQ I'd go for Sirex because ionizing radiation is not very commonly used. So I'll go for sit exit MCQ. Okay. Then the feces, urine, vomit, sputum, whatever it is, these infected kind of liquids or emissions from our body, they are dealt with bleaching powder, cresol, formalin, burning, autoclaving, boiling, these methods. So complete destruction process so that we don't have to worry about them anymore. Next is formaldehyde gas. I don't think so. OT sterilization, I don't think so. You'll get a question from this, but basically they ask, how would you clean OT? You can answer with formaldehyde. That's it. Formaldehyde. So not just the OT, the wards, the laboratory, the OT floor space, everywhere is going to be the formaldehyde. So forget about the cresol. You don't have to answer the cresol. You need to know the formaldehyde. Formaldehyde is the answer that you have to worry about. Next is skin. Skin means basic betadine or tincture, iodine, spirit, alcohol, right? Chlorhexidine. So any of them. So all those basic that we are using now. So chlorhexidine is the spirit that we are using now for cleaning the hands during this crisis period. Okay, and alcohol also, ethyl alcohol spirit that we use. Next is methods of sterilization and their biological control, which means if these organisms are destroyed, your sterilization method is successful. So for each method, there is a biological control for you to determine. So there are some organisms given here, but I would like to say only one from them because only one has appeared in your examination till now. That is steam or autoclave. So autoclave is the MCQ that have been asked. The answer is Bacillus stearothermophilus. That's it. If you know this, that is fine. The second most common point that I would like to say, a PG question once appeared, that is hot arrow 1 Bacillus subtilis. Hot arrow 1 Bacillus subtilis. If you know these 2 points at least, that is fine. Okay. So this ends our general microbiology along with immune system. So I think you guys can have a break now. Time is 9:30. You can have a break for maybe 15 minutes. You can have your breakfast. So after 15 minutes, we'll start with our other topics in microbiology. The next topic is going to be bacteriology, which is the vast topic in bacteriology. So